Hey, this is Dr. Allen once again. So today we're talking about syncope. Syncope is a brief loss of consciousness. Because if it's not brief, then it's obviously you're dead. So it's a brief loss of consciousness, and we get this a lot. The way to treat this is to first of all find out why this happened. A lot of times, 34% of the time, we never find out why it happened. It's a one-time event, and we never have an answer. First of all, you need an EKG. Well, before all of that, you actually need a history. A lot of times, and I teach to my residents and fellows this all the time, the patient will tell you exactly what happened. I was dehydrated, I haven't eaten all week, I was out at the ball game, standing outside in the sun, didn't eat, didn't drink, and I found myself on the floor. Okay, so they will tell you what happens. Or I was started on new blood pressure medication, feel like I'm always dizzy and lightheaded since this new medication, and I found myself on the ground. So the patient usually will tell you, so get a really, really good history. Second of all, you need an EKG. If the EKG is stone cold normal, you probably don't need to do a whole lot else. If there's any irregularity in the EKG and the patient has risk factors, they're older, they're hypertensive, diabetic, already have ischemic heart disease, or already have CAD, probably should get a stress test and an echogram. Now, if the patient is younger and doesn't have any of these things, and they're passing out, you probably want to get an echocardiogram. There's a few congenital things, tight valves, leaky valves, tumors, things like that could possibly lead to syncope. So definitely get an echo and see what you find. Other than that, that's about it, folks. It's really, really simple. Get all those things, and hopefully you'll be able to treat the problem. Now, if it turns out they're dehydrated, make sure they're on fluids. If somebody changed their blood pressure meds, make sure you reduce them or get rid of them. If they're on too much diuretics, make sure you cut those back and teach them how not to have that problem. And then send them obviously to a cardiologist for a workup. That's about it. I hope you enjoyed the program.